Today is the final of PSL, I think, so our students are busy with the matches.
Once it's visible, you can confirm me if it's okay. I've shared my screen. Is it visible?
Yeah, very good. Now, Ms. Faqeeha, yeah, you can use the presentation mode. Welcome everyone. My name is Rana Kamran Mahmood, and I'm leading BCBS classes on the platform of Giving Back to Pharmacy in Pakistan. I welcome all of you on behalf of Giving Back to Pharmacy in Pakistan. This is one of the most important lecture on the drug information, which will be conducted by Dr. Faqeeha. I will just introduce our presenter for today is the Dr. Faqeeha Shakeel. Dr. Faqeeha is currently working as a clinical pharmacist at the Drug and Poison Information Center and ASHP Residence Program Coordinator. Along with these roles, she is performing her duties as a preceptor as well in Aga Khan University Hospital. So I welcome you, Dr. Faqeeha. How are you?
And I'm very good. Thank you so much, Dr. Rana Kamran, for inviting me for this very, very best platform, because I've been through this platform as well, and I've been through your sessions as well. You people are doing great work, and hopefully everyone will be benefited for this.
Thank you very much for the acknowledgement, Dr. Faqeeha. Thank you very much, all of the participants, whoever is available. The lecture is recorded because I think so most of the participants I told you cannot join. So we will share the YouTube link in a week or so. So Dr. Faqeeha, the platform is for you. You may continue. Thank you very much.
Oh, thank you, Dr. Kamal. Assalamu alaikum, everyone. As Dr. Kamran has shared that my topic of presentation for today is drug information and the communication strategies. Basically, this is a very important topic because most of us, in fact, all of us have been interacted with the information regarding medication, how to communicate those information to the healthcare workers, to the patients as well. So what type of communication strategies must be used? What type of you can say that approaches or systemic approaches you can use? What type of links you can map with for the type of queries and the type of question. So my topic in my presentation is being divided into the two parts. My first part will be covering drug information, and my second part will be definitely covering the communication strategies. So moving towards the disclosure slide, I have not received any financial or commercial funding or support for today's session, no commercial trade names, no specific conflict. I have no financial relationships. Objectives which I'm going to cover today is basically the first part will be the drug information, because whenever we are providing the information to our physicians or the healthcare workers, we should know the appropriate level of learner, appropriate level of reference which we have to utilize, and how we are going to respond to the query, how we are going to build the background when we are going to respond the query, and when we are going to respond the answer of that question, and how we are going to communicate, what type of strategies we are going to opt for the appropriate level of information, and what type of health literacy is going to link with the adherence of the medications and the drug information for the different type of healthcare physician or the patients. So moving on towards the introduction, as we know that the pharmacists, especially those with the responsibilities in providing direct patient care, are basically specialized in knowledge and skills in drug information. So those skills which must involved in assessing the drug information questions are basically identifying the situations when the drug information is required and where it is required, what sources are needed, how effectively your pharmacist is answering the questions, how efficiently the pharmacist answering the question, and how appropriately resources have been utilized while answering the query. So all those skills are very much important when you are dealing with the drug information queries. So the drug information is basically being disseminated via two types, which is definitely one is the written format and the one is the oral format. And this type of drug information is linked with the any type of population. Either it can be a physician, either it can be a layman, either it can be a student, allied healthcare. Anyone can ask about the drug related concern or the information. So moving on towards the retrieving the drug information, basically this is a very important part because we do know about the different type of resources, but we don't know about how to categorize them. Because whenever you receive a call regarding drug information or when you are counseling a patient, you should know that what type of references you must utilize at that moment, at that specific time. So we have three types of resources or references. You can say that one is the primary sources, second one is your secondary sources, and the third one is the tertiary sources. I'm going to discuss those primary sources, secondary sources, and tertiary sources, but just a brief overview that specific information or an original information is being depicted or reflected by your primary sources, right? And the gateway to the primary sources via citation is towards the secondary sources. And the books you people are utilizing it for the referencing aids is basically your tertiary sources. So here is the detailed description for the primary. Primary literature is basically consists of the original research studies, or you can say that ideas and the opinions. So in the primary resources, you can say that research abstracts can be the part of it, your case reports can be the part of it, your case series can be the part of it, your published case reports can be the part of it, your unpublished or not peer reviewed are the part of it. So how you are gonna interpret it, or what you can say that basically primary sources are very good when we are answering any, you can say that off-label utilization, or we don't have any data, but we can.
Sorry, Faqeeha, to disturb. Slides move नहीं हो रही.
It's now okay.
We are just seeing your first title slide.
My screen is shared already, and I'm.
But actually, what screen we are seeing उसमें जो
एक
है वो
मिनट
पहले हाँ अब move हो रहा है. अब objectives आए थे.
एक मिनट, let me share it again. Is it okay now?
अभी फर्स्ट स्लाइड ही है, लेकिन जब पहले अब मूव किया था तो ऑब्जेक्टिव्स नजर आए थे. अब सही है. रिट्राइविंग ड्रग इन्फॉर्मेशन ठीक है. अब
ठीक
सही
है
है.
बस
अब ठीक है.
ठीक है. Okay. Thank you. Moving on towards the retrieving drug information. Okay, I was on the primary sources. So primary sources, I've told you that it can be case reports or the case series. One example I'll share with you that I've received one of the patient with the isoniazid poisoning, and we don't have the IV pyridoxine. So what we search, we utilize our primary resources, and we went through some original case reports, and that case reports actually stated that When you don't have the IV pyridoxine, you can utilize the oral pyridoxine in the 5 gram, and you can just make a slurry and you can administer it from the NG tube. So these type of primary sources are very much helpful in the different type of scenarios. So the disadvantage, or I can say that the issue with the primary resources, you will be having different type of aspects in the case studies. You will be having different type of conclusions. So when you are analyzing and when you are formulating your answer, so you have to go through number of case reports. So you'll get the important points. You will address the important points what you want to. So this is what the primary resource is. And for secondary sources, you can say that it consists of major part is consisting of indexing or abstracting the databases where the citation has been used. Or you can say that it's basically a gateway to the primary literatures. You have heard the name about the PubMed or Medline. These are all come under the secondary resources. Our third part is the tertiary resource. Tertiary resource is one of the part which is very convenient and very easily usable information that has been synthesized and has been utilized in the number of fields or the number of queries. You can heard EHFS drug information book. You can heard about the Martindale. You have heard about the Micromedics. You have heard about the Lexicom. You have heard about the Harriet, BNF. These type of all referencing range comes under the tertiary resources. It's very easy to extract the information from the tertiary sources because it's been concluded in a very concise way in only one platform. So it's easy to extract your information. So depending upon your type of question and depending upon your type of query, you can opt the appropriate level of resource, either primary, either secondary, or either tertiary. So moving on towards the specific type of drug information, because as I've told you earlier, there are multiple queries when you people or a pharmacist can encounter when working in a field in a drug information center or as a counseling pharmacist. So I have tried to summarize it, the most common types and the types of references which we can utilize when we are going to answer these type of queries. For adverse drug reaction, usually we have updated website of the FDA on which they update the leaflets as well, and they update if there is a safety alert or the adverse drug reaction addition after a quarterly update or a monthly update, you can say that. And we do have the Micromedics and UpToDate. If they are the paid version, they are not the open access, but yes, we can encounter the adverse drug reactions from that resources as well. For the compounding, extemporaneous compounding preparations, or for the stability of your injectable drugs when they are being prepared in the IV area. So for that reasons, we can utilize the trissels, and this is the practical approach. We have the trissels, and we usually go with the trissels to verify the stabilities and the extemporaneous compounding preparations. For interactions, we do have Micromedics. We do have, we can use the UpToDate as well. And there is a book you can utilize, the stock-laced drug interaction. It's available as well on as an ebook, or you can say that electronic book. For the appropriate medical information, you can utilize UpToDate, Dynamed, Micromedics. They are all paid version. And for pregnancy and lactation, LactMed is a website. It's a free access. You can utilize it. And there are some free access handbooks available for the pregnancy and lactation, because you know that whenever we are going to answer the query regarding the lactation, so we should know about the RID, which is a relative infant dosing. Relative infant dosing is if the less than 10%, then it can be, that drug can be taken via breastfed mother. But if it's greater than 10%, then it should be cautiously used, or it must not be used. So these type of information, you can get it via tertiary resources, easily mentioned below that handbook and the LactMed website. For the special population, you can say that like pediatric population, or for the geriatric population, for specifically neonates, we can use with the Harriet Lane and the BNF as well. And we have new facts as well. Again, new facts is a paid version, but Harriet and BNF you can find as a electronic books online, and they have the updated versions available. For toxicology, we can check out with the micromedics toxicology, and we have certain sort of poison index available online, through which they can let you know about the antidotes and when to give charcoal and when not to give charcoal, when dialysis should be done or when not. So these type of resources are all tertiary resources, and you can easily find out the appropriate information just with the one click. So moving on towards the drug information question, or assessing or making an approach for the drug information question. So we have total of 7 steps for answering the basically drug information queries. Step 1 states that you need to get the demographics of the patient, which is definitely a very important part of it. Because once you don't have a demographics, you won't be able to prepare a background and you won't be able to conclude your results. So for step 1, initially you have to check the demographics. For step 2, you need to gather the background information. Background information is very much important because you need to check for what type of medication or the investigation or the event that led to that question, why that question is being asked. So for that, you need to gather a background information. If I can give you one example to gather a background information, for example, if the person is asking about the digoxin, then you need to ask what is the for what reason you are going with digoxin, the renal function is fine or not, the patient is stable or not, you have digitalized the dose or not, whether to go with IV or PO. Have you been exposed to digoxin previously or not? Have been digoxin? If yes, then digoxin concentrations. What are the digoxin concentrations? So these type of background building is much important to evaluate and to analyze your question. Your part 3 is stating about the determination of a true question, because I believe that whenever a patient came or a caller usually calls, so the initial question is very vague and very rough. It does not give a proper point of view what actually a patient is trying to ask. So to clear the questions for the step 3, you need to ask what actually a question is, and you need to repeat your question, what type of query he wants to ask or for what reason he is going to ask. For example, if I can quote one of the example, that a man in his mid-20s presented at a community pharmacy to ask what the pharmacist recommended for the treatment of heartburn. That was the only question. But in reality, that requester was actually asking the question on behalf of his wife, who was experiencing the moderate heartburn symptoms at the bedtime, and sometimes after eating the spicy meals as well during the first trimester of her pregnancy. So you need to clear the question and clear the reason and clear the requester as well. For information is for what either that is a patient or he's asking or she's asking for another requester or another patient. Step 4 is to categorize the question. So how you are going to categorize your question, that is what there is a one approach which is called as a PICOS approach, PICOS approach. Actually, we are doing on daily basis each and everything, but we don't know actually which approach we are following. PICOS approach states that P for patient, population, or a problem. That indicating population means any of the geriatric patient falling under the criteria of, you can say, Beer's criteria, or a neonate. So if we need to check the renal dose adjustment, then which formula we need to apply, either to go with Schwartz, either to go with Cockcroft. So what is the problem, what is the patient, and what is the population? So initial step is to identify the population and the patient. And then we have the second part, which is the intervention or interest. Basically, this is linked with the medication. The key part is the medication, because we are going to focus on the medication which is involved in the question, right? So, and our third part is comparative control. It's not normally comes under each and every query, but yes, when we are discussing the clinical literature, so we can just compare the efficacy and safety with one drug to other one. Second one is the outcome. What effects of the medication's efficacy or safety are of particular interest in that question? What is your outcome when you are when you were taking the medication, and now when you are counseling that medication to that patient for the systemic approach? And your last part is considering as the setting one. Setting is if you are counseling a patient, or if you are counseling or you are talking or communicating to a healthcare physician. So for that reason, what type of setting is being used? Is it the acute critical area? Is it the ambulatory area? Or you can say that it is being used for the admitted patients. So after the step 4, you have built your background, you have your demographics, you have a very clear picture of your question, you have already categorized your questions. Now the part is to evaluate, which is the step 5. You have to evaluate the information, you have to analyze the information, you have to strengthen your evidence, and then you have to communicate a response. So step 6 will be your communicating a response. On the basis of evaluating the information, you have built your response and you have communicated that response. Step 7 is not being followed in each and every cases, because follow-up is not required everywhere. But yes, when a person is working in a community setup and there is a patient who is asking for the refill medication, so yes, for checking out the adherence of the medication, you can check the follow-up, or you can take the follow-up. Or even if you are encountering with the calls of the poisoning, so yes, you can go with the follow-up of that poisoning call as well within the 24 hours or whatever the time frame you have set up for it. So my previous slide says that the type of questions. So here are certain type of question which you need to identify. And once you are able to identify the type of question, you have to build the background data. And once you are able to build the background data, you need to link and map your question type with the type of reference or resources you are going to utilize to formulate your communication or to formulate your response. So if I can give you one of the example, like for example, someone asked you about the dosing of paracetamol, right? So what you need to build, you need to build the background data for the age, because if the pediatric, then your dose must be in mg per kg, right? You need to check out the indication. You need to check out, is there any current diseases, or even if there is a liver impairment, if it's present or not. What are the recent medications, if there is an interaction or not? What is the organ function? So all these information are mandatory and required to formulate efficient and appropriate response of the drug information for the requester. So for that dosing purpose, what you are going to opt for the tertiary resource. For example, you do have a Lexi drugs available, you do have a micromedics available, you do have a UpToDate available, you do have a BNF available, you do have a Harriet Lane available. So you can utilize all those references to answer your query, right? For the drug selection or the off-label uses, we have the AHFS guides. We have the UpToDate as well. If you people have the access of UpToDate, you can just check out that UpToDate has the 2 types of indication. One is the FDA labeled indication, and one is the off-label indication. So it represents the both of the indications. So it depends upon your query. If it's an off-label usage, then which resource you are going to opt to answer your query. So it's the same type, the type of interactions you are encountering. So for interaction, which type of tertiary source you are going to opt. For example, it's a micromedics, it's a stock list, as I have told you earlier. For pediatric and geriatric, what type of things you need to notice, whether your geriatric is falling in the Beers criteria or not. You have to check the BMI, weight, height, each and everything to map out your tertiary source with the question type. Okay, so we have one question. It's linked with my previous slides, which I've covered. The question states that a staff pharmacist at XYZ pediatric hospital receives a medication order for a 12-year-old female patient for intravenous immunoglobulin. The patient is currently admitted to the hospital for acute myocarditis unrelated to rheumatic, septic, or toxic causes. The patient has no other discernible reason to receive IVIG, but the pharmacist is unfamiliar with this off-label use. Which tertiary reference would best be checked to gather more information about this topic from an off-label use perspective? So, any idea about this? What type of tertiary reference we are going to opt? We have a hint here, like we can't go with manufacturer provided patient information because it contains only the labeled uses, right? And I have told you earlier that drugs at the rate FDA is always being utilized for the FDA labeled indication. Daily Med is linked with FDA as well. So we are left with AHFS drug information. So this is what the tertiary reference we will opt for the off-label usage. So we have the second question. It states the same. The question is the same. You are going to put the PCOs and you have to correctly extract the option. For example, I have told you earlier: P for patient, I for interest, C for compare, O for outcome, S for settings. So, what will be the correct option in this? If I can opt the previous case history, the patient is with IVIG and with acute myocarditis, and the patient in peds as well and admitted in hospital as well. So what will be the option, right option? Okay, so the correct option in this, I have told you that P stands for population or a problem, right? So A states for acute myocarditis, which is the correct option. O is the outcome. Outcome doesn't come under the hospitalization. And I interest is with the IVIG, not with the pediatric, not with the patient, right? So the correct option for this case study is acute myocarditis, which is the actual problem of that patient to which we are going to administer the IVIG, right? So here we are ending with our part 1, which is a drug information. Now we are moving towards the general communication strategies. On daily basis, we are following those strategies, but definitely we don't know the systemic procedures and we don't know the names of the tools which we are following. So this is just a general recommendation and the general strategies which I am going to discuss here. So initially, I'm going to discuss your verbal communication with the ADIT tool. What we usually do in this tool is it's a journal information we usually doing on daily basis. So A stands for acknowledge. So whenever we are receiving any call, sorry, this is AIDET. It's written wrongly. So when we ever receiving the calls or we are counseling the patient, we always greet the patient first. So here at drug information, whenever we receive the call, we say Assalamu alaikum or hello. This is drug and poison information, and then we greet the patient, and then we take the first names of the patient when we need to call them. because you know that the identification of the patient and correct patient is basically a best tool to respond or give the information of the appropriate medications. So whenever you are dealing or counseling with the patient, there must be a proper setting or proper full attention must be given to that specific patient. There must be a proper acknowledgement of the purpose for what reason the patient is here. So we need to acknowledge that purpose and we need to encounter that purpose, and how we are going to encounter it. This I'm going to tell you in the next slide. Then you need to introduce yourself, and then you need to mark the duration, because time limitation matters a lot. So you need to set a time frame on which you have to answer your query, because it must not be delayed and it must not be very quick, that the answer expectations will be reduced. So next part is the explanation. So you need to explain each and everything step by step using the systemic approach, which I have told you earlier. You people have to, you can say that whenever you are explaining that query to that patient, after giving proper explanation, you can provide your contact numbers if you're working that organization and that organization have that drug and poison information center, or they have the official email on which they will contact you back for the written communication again. So you, at the end of the explanation, you can provide your telephone number or the email address. You need to focus on the mutual agenda for the visit, right? What the patient want to discuss. If the patient want to discuss about the blood thinner, then you need to stick about the blood thinner discussion, and you need to go through stepwise approach, checking about the drug-drug interaction, the food interaction, each and everything you need to discuss with that patient, right? And when you are closing, then definitely you need to decide, or you need to summarize the decisions efficiently, and how you are going to conclude it matters a lot. So at the end, when you are going to conclude it, you need to thank the patient or a caregiver, whoever he or she is. So that might express the gratitude to them for choosing or opting your service and whatever it is, right? So this is just a tool which you are following on daily basis, but actually you don't know the name of that tool. So this is AIDT tool we usually follow. So moving on towards the non-verbal communication. Non-verbal communication is basically, I can say that it's not much important when you are communicating or encountering during the call center, but it is very much important when the patient and you are standing physically face to face, like in community setups or in the ambulatory care setups or in the clinic setups. So the body language and tone are more are important foundation for developing patient-provider relationships, right? So there are certain type of terminologies which has been used to explain the non-verbal gestures. So one is the terminologies proxemics, which is basically maintaining the physical distance between the people. This is very important, I can say that, because once the patient is standing into the community pharmacy, there must be a proper physical distance available. Must not be too, the patient must not be too away and must not be too close to that pharmacist. If he or she is away, then he is not able to listen properly, right? So there must be a proper physical distance maintained between both of them. Then we have another part which is called as chronamics. Chronamics is basically use of time, which I have told you earlier. Oculesics is the use of eye contact. This is a very important part because it gives you a confidence as well, not only to you, to your patient as well, to build your relationship with the patient. Haptics is usually not commonly used because use of touch is not needed in every counseling parameter or every communication strategy. It's usually used when there is the empathy required for that specific patient. And then we have a kinesis. Kinesis is the use of body movements, which we usually do when we are talking and when we are counseling to the patient. The next part is the objectives. Objectives is basically use of the objects. Whenever you are counseling a patient or communicating a patient and you are using any of the object, for example, if you are a counseling patient for the INR machine and you are using that INR machine, then that is called as the objectives. Not only the objectives or the devices you are using, but the flyers and the education material you are going to give to the patient for that specific query comes under the objective. And then we have a vocalix. Vocalix is the vocal tone and pitch, which matters a lot, when to raise your pitch and when to slow down your pitch. So to maintain your communication with the patient. So these are the certain terminologies which were discussed in the document. Actually, one more thing which they have focused on is the active listening. So you need to engage in the active listening because you need to react to the ideas. Because once you are not able to listen to the patient properly, you are not able to build your background, you are not able to formulate your response, and you are not able to communicate properly. So you have to be engaged in the active listening first. You have to give time to the patient to give or to let you know the detail of your query. Read the patient's body language first when you are going to communicate or formulate a response for that specific patient, because it matters a lot for the body language. If you are going to formulate your response in English and the patient is not able to identify it, so that will be a communication barrier, big communication barrier in between. Permit silence. There must be a proper silence where you are dealing with that patient for the counseling or communication. So you can, your understanding level must be increased, and ask for the clarifications as needed. Usually I have seen that pharmacists never ask about the clarification. Once the information the patient has given, they said that it's appropriate one, but you need to ask furthermore, so you will be able to address the query of your patient or the provider in the very efficiently manner or the appropriate way. So non-verbal communication comes, or you can say that after the active listening, it states the empathy as well. So for empathy, you can say that there are several types of empathy, how you are going to show your empathy. So they have classified the purpose and the action used for the empathy in the non-verbal communication. So there are certain examples which I have showed here. For example, if you are going to use the reflecting method, for example, if you need to understand the person's feeling. So, for example, if one person is calling continuously on drug and poison information center and our lines are busy and he is not able to link with us after certain time of period, we are able to receive the call and the patient was very upset. So that the action which I am going to use will be the reflecting one, because I have understood the patient's feeling and now he's not very well because he want to contact with us, but it's been long time. So we are going to start our conversation with that. You seem very upset, and I know this is a very tough time, but we are here to answer your queries and address your queries. So this is what actually a reflecting is. Encouraging, then we have the encouraging method. Usually when we are counseling a patient in the community setup or communicating with that patient, he comes with the new blood reports of HB1AC, and he says that my HB1AC is being improving, my blood sugars are improving. So you are going to encourage that more. Please tell me more about it, about your lifestyle after the oral medication you have been utilizing, what changes you have been made in your lifestyle. So this is what the encouraging part of it. And then you have a summarizing part to review the progress and pull together important ideas and facts for the formulating part. It is clarifying the answers, restating. Restating is basically to show the listing and understanding of what is being said and to help speaker clarify what they are saying. So you have to go on the level of your requester to address that query, right? And then validating to acknowledge the worthiness of the other person. you are doing a good job, keep track of it, keep track of your blood pressure, and that's improving. And these sentences definitely makes a day of your patient once you will encourage or you will show the empathy to them. So there are certain points I can say that whenever you are addressing the query, there must be some key questions at the key time which you have to utilize. But it's not mandatory every time you have to utilize it. But certain acronyms have been made, and you can say that majority of the time when you are answering the query to the physician, you can definitely utilize this acronym, which is symptoms. What is the main concern or indication? You can ask that. Characteristic. It's not mandatory to ask every time. It's linked with the query to query or scenario to scenario. History, you need to definitely check a history or build a background. Onset, you need to ask whether to start with it or not, because it matters a lot in a lot of different medications. You need to check the onset. When did thing happen, when hives starting, sort of like that. So location, what is the location and what is the area? What are the aggravating factors? What are the medications you are using initially to identify either there is a drug-drug interaction or not, or to identify some sort of allergies which is not being updated if the patient is admitted here. So we need to update the allergies as well. What are the other conditions if the patient have it? So high risk diagnosis or the other condition must be added into the patient profile if you are communicating with the physician healthcare workers. So whenever they are prescribing any of the drug which is not basically, or you can say that which is contraindicated in that indication, can show a pop-up or can definitely let you know that this drug of choice is basically not a drug of choice for that specific patient. So you need to optimize it and you need to modify your therapy. So next part is again, it's linked with the same scenario. It's called as the background. In this, you need to check the background, affect, trouble, handling, empathy. For what reason it has been basically used? This is, you can say that it is when the patient is dealing with some problems, when there is an emotional component attached or emotional support wanted. So in that part, we can go with the background, which is background, what is going on in your life to affect, how do you feel about that, trouble, what troubles you the most about this. So this is sort of, you can say that interview type of thing, which usually a physician can do or a pharmacist can do as well. So moving on towards the motivational interviewing. So what actually a motivational interviewing is, it's basically, you can say that the type of counseling and the strength of counseling you give to the patient, and the patient is being motivated to do so. So it comes under the three scenarios, or you can say that four fundamental process of motivational interviewing is: one is the engaging, second one is focusing, third one is evoking, and fourth one is the planning. So you can say that engaging is basically a process of establishing a mutually trusting and respectful helping relationship. For example, there is the thing, you can say that reflective listening, right? If you have listened to the patient, so and you knew your medications, and you knew that patient's medications are working, so that patient is not going to miss any of the dose. You have to listen it, and then you have to react or reflect on that listen, right? For example, if any of the patient says that, okay, I'm worried that this new diagnosis will be very difficult for our family, and a lot of my family members are avoiding the medications. Now you have listened that query, and now your part is to reflect on that listening after the active listening. So if you knew that your medications are working, you would not miss any of the doses throughout the week. So you are going to comment on the listening to give the motivation, or to give the strength and spirit to that patient. And then focusing. Focusing is basically process of strategically centering both the provider and the patient goals. My goal is to give the appropriate information or to address the patient, and patient goal is to achieve the appropriate information and to achieve the motivation to focus on that specific medication or to focus on that specific treatment regime. Evoking is basically bridge to the planning. For example, if someone is asking in different ways, so you can elaborate that thing, like tell me more about this. What is the best thing of this change in the lifestyle modification? What would life look like if you are going to use your medication in an appropriate way? So these type of elaboration can definitely evoke a patient, and that evoking can be linked or can be bridged to the planning, because then after that process patient is going to plan about it. Yes, this thing is working and now I have to definitely utilize it and I have to manage it as my physician or my pharmacist told me. So the example in planning is usually what's your next step in order to achieve your goal. So this is what a planning is. So you initially start with engaging, then focusing, and then evoking, and then the planning. Next is SBR. SBR is a very common format. It's being used. Everyone is well aware about it. Situation, briefly describe the situation of the problem, background. I have already told you to build a background assessment and then the recommendation appropriately as per the patient's need or the healthcare physician needs. So there are certain general guidelines which you need to avoid when you are writing an email, that you should not be forwarding the chain email. You should not be utilizing using emoticons. You should not be using all capital letters. Spelling errors must not be done. Drifting off topic, where you should stick to the topic which you are talking about. You should be very clear about it. You have to use 7 C's. Everything must be clear. Everything must be concise. Everything must be summarized. So these are the certain parts which you need to keep in mind when you are writing the email. So next and the last, probably the part is the health literacy. Basically, this part is, I can say that is not much linked with the Asian population, because the data which I'm going to share and the theory which I'm going to share about you is the related to link with the American population. Why there is a need of health literacy or to study a health literacy? Because we know that the individual we are going to answer them, what is the ability and what is the understanding level of that patient, right? So we need to check whether that patient is literate or not literate. So we need to counsel the patient as per that understandability and the level of understandability. So there are total of 4 literacy domains on which they are scoring the requester, which is a reading, writing, speaking, and numeracy. And these, there are 4 performance levels on those literacy domains on which the requester has been leveled. Level 1 is your below basics, and level 2 is your basic, and level 3 is your intermediate level, and level 4 is your proficient level. Basically, what finds in it that below in below basics, patient is totally unable to solve even the dose calculation chart, mathematical calculations, or any of the information. He is unable to retain or sustain any of the information. This is what the below basic level is designed is designated for. Level 2 is basics. Patient is able to retain the information, but it's difficult to interpret certain type of dose charts, for example, insulins. Level 3 is intermediate. It's a like mix and use. Like patient is able to understand, but their numeracy levels, the use of numerics is not good enough. And in the level 4, proficient level is able to identify all type of issues. For example, if I can say that I'm taking the name numeracy again and again. Whenever we are counseling a patient, there are some sort of solutions available which we need to reconstitute it. So we usually tell them uh, how much amount of mLs are required to reconstitute it, or whether for IV medication or whether for the other oral medications. You can say that for IV, so definitely there is a healthcare worker will be there for to administer it. But for oral medication, the formulation, people are unable to understand it. So these are the performance levels they have graded on. So that grading or the level is being done with these tools. So how they are going to grade them, that patient is on level 1, level 2, level 3, or level 4. So they have designed some screening tool for the health literacy to check the health literacy of your patient, basically. So there is a one tool which is called as the RealM tool, Real Estimate for Adult Literacy in Medicine. What they need to do, this is a very common testing. They usually says that this is a word recognition type of thing in which they give 66 common words. It's common in all of the thing. It's common in all of the cases. Total 66 of the common words, and they have to read it or understand it within 3 minutes of the scoring. So you can say that this type of description or this type of tool can be used in the research studies and to identify the basic reading grade level of that patient or that specific target or the variable. It's not important that we always go with 66 common words. There is a one shorter form for RealM as well. So for the urgent data, we can go with the shorter version, which is a 7-item word recognition. So this can be done as well, depending upon which type of study they are doing. So there's another tool which is Sahalsa 50, which is about for 50 words of the choices. And again, it is used for the research studies as well. Basically, that is a comparisons between the English and the Spanish speakers, that they are able, those who are Spanish but not are able to talk Spanish. Though those who are English, those who belongs to the English community but not able to speak English, rather they are able to speak Spanish. So that's comparison they usually do in the different research studies. Then we have another reading capacity test for the TOFHLA tool, in which we can check not only the reading capacity but also a numeracy capacity as well. So there are 17 numerics and the 50 reading words which they have to definitely respond in between 22 minutes. And again, there is a shorter version which is of currently based on the 36 requesting levels. Again, we have NFS, SLS, and SNE. There are other health literacy tools which they usually utilize in different clinical assessments as well and clinical research studies as well. So the last thing which I want to discuss is the health belief model. Basically, it depends, or they have the 4 constructs, which is susceptibility, severity, and the barriers. You can find or you can encounter a lot of patients here who can say that my disease or my condition is getting worse, or I have some sort of cold or flu, I can take the antibiotic. I have taken antibiotic a year ago for my respiratory tract infection, and I have again respiratory tract issues, so I can take similar antibiotic again. So you need to tailor your educational messages for those specific patients or for those specific constructs. So they have divided the construct into the 4 parts, which is the perceived susceptibility. The descriptions says that the individual's beliefs about their likelihood of contracting the disease. So if you are very much worrying about that, you can contact that condition or that disease. For example, anytime I get sick, a short course of antibiotic does that trick. So that similar example I have given you. So explaining that thing to that patient, that every time that antibiotic is not going to work. right? They do have some sort of adverse drug reactions, and it's not antibiotic is always for that specific condition or for that specific thing. So there is an other construct which is called as perceived severity. Perceived severity is basically linked with the seriousness of the condition. For example, I have had high blood pressure most of my adult life and I'm still here. I feel just fine. So there is no need to break the medications for the high blood pressures. So you need to tailor your educational messages for those patients, that explaining how the effects of high blood pressure can accumulate and present or can hit the patient in the different complications and the severity of the condition as well, like stroke, heart attack, and other kidney diseases. Then we have the second last construct, which is called as the perceived barriers. So it's about the beliefs on the negative aspects of the change. For example, if the patient is being diagnosed with the celiac disease and he says that I can't afford all those gluten-free foods, so this is going to be impossible for me and I'm not going to utilize it. So now you have to convince a patient. Now here it comes a motivational thing for that patient. You need to explain the benefits of eating gluten-free foods first, and then you need to discuss that how many foods are naturally gluten free. Okay, so you can share the example with them. You can share some local manufacturers with them, which is like pocket friendly, so that barrier can be removed for that patient. And then we have the cues to action, any factors that triggers the action. For example, 82-year-old woman is unwilling to take prescription medication for depression, and she says that she does the self medication with other natural products, for example St. John worts, and she says that my depression is getting better due to that St. John's wort, which is self medicated. So you need to tailor your educational messages that how that supplements are basically are not completely free of adverse drug reaction, and there are a lot of drug interaction with John worts. So you need to take your the prescribed medication rather than giving or rather than taking this medication by your own. So these actions speaks along with your educational messages for the patient's need. So we have a question here. Last one. A patient is working with the pharmacist to determine a correct dosing regime for bolus insulin. The patient has the difficulty of calculating the dose. So what after a few months, the patient still cannot apply the simplified dosing regime, which most closely resembles the patient's national assessment for adult literacy category is. So anyone can want to answer this? As the patient states that there is units belongs in it, right? Numerics belongs in it. So a patient is unable to apply simplified dosing regime. So it comes under the below basic level, which is the level 1. So we have, this is the question, this is the answer of that question. So we are done with the drug information and the communication strategies. I've tried to summarize each and everything in the document. There are certain points which I would recommend to read it out, because that's a simple instructions written there, when to use Medscape and when to use Medline, when to narrow down your therapy, narrow down your research, or narrow down your answer, and how to narrow down your answer. So that summarized from the systemic approach, but in detail, definitely you can read from the document. This is all about the presentation. So I'm done with it.